COVID-19 is very challenging for the physiotherapists as they have to make direct contact with the patients. But they should use protective equipment as most people who contract coronavirus, COVID-19, recover. But about 14% will have a severe infection, and a further 6% will become critically ill. Research shows 16% of those hospitalized need an intensive care bed, often for prolonged periods of time. Some will need to be placed in a medical coma on a ventilator. During this critical period, specialist physiotherapists will remotely monitor patients and decide if they're needed to help a patient's respiratory function and physical recovery by looking at factors such as a person's oxygen levels, blood test results, lung scans, and following discussion with their colleagues. Here are some of the problems that physiotherapists can assist with when people are in hospital with COVID-19. Low blood oxygen. People with severe COVID-19 infections suffer from low blood oxygen. Patients with difficulty breathing because of the virus will have worsening lung function and won't be able to circulate oxygen properly to the body's essential organs. In moderate to severe cases of COVID-19, prone positioning, lying face down, is recommended. Lying face down for hours at a time can increase oxygen levels in the blood. This is because it helps match air to blood supply in the lungs, and also opens up areas of lung tissue to allow more gas exchange. Often, this treatment is used when patients are still critically unwell due to COVID-19. Moving the patient in and out of prone positioning requires a large team of specialist staff which can include physiotherapists. Physiotherapists may also recommend other positions, such as side lying, to assist lung function depending on the patient's condition. Physiotherapists can be involved in the treatment of people using non-invasive ventilation, or may in some cases suggest or set up this equipment to improve lung function. Non-invasive ventilation is a form of breathing support that doesn't involve inserting a tube into the airways. This is usually done through a face mask, or a helmet, which can limit droplet spread of the virus. Mucus in the lungs and difficulty breathing. While many people with COVID-19 have a dry cough and don't have problems with excess mucus buildup, patients can also be taught breathing exercises to help them cough up mucus on their own. A negative pressure room, where air can't be circulated outside the room, is also useful for preventing further virus spread. Weakness. A big focus of physiotherapy during the pandemic will be to get patients moving as soon as possible. But this can only happen when the patient is well enough. This can start with simply getting patients to move their arms, legs and body in the bed. Physiotherapists will closely manage vital signs such as oxygen levels, respiratory rate, and blood pressure to ensure movements are safely tolerated. All these problems can be assisted by physiotherapist but only under special care and by protective equipment to protect him being infected.